Hi, and welcome to today's Daily Chronicle. Today is Friday, April 18th, 2025. Stem cells to treat Parkinson's. Two small studies hint at success. Two new studies suggest that stem cell treatments may be getting closer to being widely available for Parkinson's patients. Patients suffering from Parkinson's disease may soon benefit from a powerful treatment option: stem cell transplants. In a pair of studies designed primarily to test safety, two teams of researchers found that stem cells transplanted into the brains of Parkinson's patients began producing the chemical messenger dopamine and appeared to ease symptoms like tremor. Researchers reported in the journal Nature. The results indicate that now we have the potential to really halt this disease in its tracks, says Dr. Maya Shees, a neurology professor at UT Health Houston, who was not involved in either study. The Food and Drug Administration has cleared one of the stem cell treatments for Phase 3 study, the last hurdle before approval. About 1 million people in the United States are living with Parkinson's, a brain disease that attacks neurons that make dopamine. As those neurons die, patients can range of disabling symptoms, including tremor, rigidity, fatigue, difficulty walking, and cognitive problems. Stem cells are immune, mature cells that can develop into many different cells types, including neurons that make dopamine. Positive results. One of the new studies involved 12 people in the U.S. and Canada living with Parkinson's. Surgeons administered either low or high dose of stem cell product from Blue Rock Therapeutics, a subsidiary of biotech and pharmaceutical giant Bayer. The treatment was derived from human embryonic stem cells. Had coaxed into becoming immature brain cells called neuron progenitors. During the surgery, these cells were injected into the structure on each side of the brain that involved movement. The idea is to place these neurons, progenitors, right where you need them to connect with the other neurons in the brain. says Dr. Vivian Tabar, a stem cell scientist and chair of neurosurgery at the Memorial Sloan Kettering Cancer Center. Tabar is also a founding investigator at Blue Rock. PET scans take 18 months later showed that the transplanted cells were producing dopamine. An assessment using a standard rating scale of Parkinson's progression suggested that the treatment was also easing symptoms. For typical Parkinson's patients, you would expect every year to get 2 to 3 points worse, says Dr. Lorenz Studer, who directs the Center for the Stem Cell Biology at the Sloan Kettering Institute in New York and is a scientific advisor to Blue Rock. Participants in the study had a very different experience. The high-dose group, they got about 20 points better. The low-dose group also appeared to benefit, but not as much. A second study of research in Kyoto, Japan, used induced pluripotent stem cells, which are derived from a patient's own cells. Rather than an embryo. 7 patients had the cells injected into both sides of their brain, as in the US and Canadian study. The transplanted cells produced dopamine, and the patients appeared to see their symptoms decrease. No patient in either study is experienced a serious adverse event. Long time coming. The apparent success after decades of frustration trying to replace the brain cells killed off by Parkinson's. Starting in the 1980s, scientists began transplanting fetal tissue into people with Parkinson's, but the effort produced even uneven results and sometimes troubling side effects like uncontrolled movement. Stem cells promised better results, but the technology evolved slowly. Studer's team, for example, began looking at stem cells to treat brain diseases more than 25 years ago. For us, it's quite an exciting time, he says. Finally seeing some of the fruit of that work. One reason it's taken so long, Studer says, is that stem cells have the potential to become so many different types of cells. It just takes the right mix of chemicals at just the right time to produce a neuron that makes dopamine, he said. It took us nearly 10 years to figure out the recipe, to have the product of what we would dare put into patients. Another challenge was creating and packaging large numbers of stem cells that could be easily delivered to surgeons. So researchers developed the techniques that allowed them to freeze stem cells until they were needed. You just thaw them and suspend them in approved medium before surgery, Tavar says. Now that many of the technical hurdles have been cleared, the stem cells appear poised to offer a new treatment option for Parkinson's and perhaps other brain diseases like epilepsy or Alzheimer's. If we're missing neurons, we're able to replace them, Tabar says. And the full expectation is that these cells are not going to function as cells that just release a substance like dopamine. They're going to rebuild circuitry. There still may be risks, though, which means scientists will need to continue monitoring the stem cells they transplant into the patient's brain. They're going to be there for a long time, she says. So if you have to follow up and see there is a tumor forming or something of that nature. Sage also notes that the stem cells don't cure an underlying disease like Parkinson's, so the new neurons may eventually succumb to the same disease process. Even so, she thinks they could offer new hope to many patients, including those who are no longer responding to drug treatment. A colossal squid is filmed in its natural habitat for the first time. This is the first confirmed live observation of the colossal squid, Mesohamiltoni, in its natural habitat. The team on Smith-Ocean Institute's research vessel Falkor captured footage on the nearly 1-foot squid at a depth of 1,968 feet using the remotely operated vehicle Sebastian on March 9th during an Ocean Census flagship expedition searching for new life. A colossal squid has been captured on camera in its natural habitat for the first time in the 100 years since its discovery. And it's a baby. The squid, measuring about 1 foot in length, was seen nearly 2,000 feet below the surface in March in the South Atlantic Ocean. The Smith-Ocean Institute said in a statement. The footage was recorded by an underwater vehicle operated remotely by a crew from the organization. It's exciting to see the first in situ, on-site footage of a juvenile colossal, and humbling to think that they have no idea that humans exist. Said Dr. Kat Bolstad, an associate professor of the Auckland University of Technology who helped verify the footage. For 100 years, we have mainly encountered them as prey, remains in whale and seabird stomachs, and as predators of harvested toothfish. For 100 years, we have mainly encountered them as prey, remains in whale and seabird stomachs, and as predators of harvested toothfish. Bolstad explained to NPR The reason colossal squids have likely not been caught on camera until now is due to their large, sensitive eyes, which probably cause them to avoid research equipment that can be bright and loud. Sometimes squids may respond to threats by holding as still as possible, hoping to go unnoticed. Because of their elusive nature, researchers still know little about their diet, lifespan, or reproductive traits. Much of what is known has been learned from similar species. But Bolstad said in this new footage, scientists may gather more information about how colossal squids behave early in their lives. The juvenile squid displayed had pearly eyes and organs and was transparent, typically for members of the Cranidae family, also known as glass squids. As it matures, it will likely become more opaque as its muscles thicken, Bolstad said. The moment the crew saw the squid, Tom Linney helped develop technology for deep sea research and is curator of fishes at the Museum of New Zealand, Te Papa Tongarewa. He was on the board the ship, gathering his notes to prepare for leading a dive for the first time. Then he caught a glimpse of the squid out of the corner of his eye. Lindley, an expert in deep-sea fish, had begun to learn about squids from Bolstad. Oh no, this might be important, he thought to himself. He quickly sent a low-resolution image to the invertebrate to Bolstad, when he later described as incredibly cruel, since it was not detailed enough for identification. While colossal squids grow to be quite large, their defining characteristics can be quite subtle. So Bolstad needed a more substantial image to confirm its identity. She's climbing the walls like, give me the high res, Lindley recalled. Aaron Evans, an independent scientist and glass squid expert, viewed the low-resolution image of the squid and was readily able to identify it as a type of glass squid, a species that he has studied for a decade. But he became particularly excited when he heard it was captured near Antarctica, where colossal squid exclusively reside. He and Bolstad identified key characteristics of a colossal squid, such as hooks on its tentacles. We got very excited and we started hyperventilating. I can't speak for Kat. I started hyperventilating, Evans said. More on colossal squids. Colossal squids live in deep sea near Antarctica. They can reach lengths of 23 feet and weigh at least 1,100 pounds, making them the heaviest known invertebrates. Their tentacles feature hooks that help them catch prey and defend themselves against predators, such as sperm whales. These intriguing creatures were first discovered in 1925, when two of their appendages were found in the stomach of a sperm whale. It's important to note that colossal squids should not be confused with giant squids. While giant squids are longer, they are not as heavy. Giant squids also inhabit the deep sea, but are found in tropical and temperate waters. Luigi Mangione indicted in federal court in CEO killing. Luigi Mangione, suspect in the killing of United Healthcare CEO Brian Thompson, was indicted on 4 federal counts in December. He was escorted by members of the NYPD following his extradition to New York. New York. Luigi Mangione, the 26-year-old accused of killing United Healthcare CEO Brian Thompson, was indicted on Thursday. By a grand jury in Manhattan Federal Court. The charges include 2 counts of stalking, 1 firearms offense, and murder through the use of a firearm, which, if Mangione is found guilty, could make him eligible for the death penalty. Earlier this month, Attorney General Pamela Bondi directed federal prosecutors to seek the death penalty in Mangione's case, the first time the federal death penalty has been sought since the Biden administration placed a moratorium on federal executions. Mangione's attorney, Karen Friedman Agnifilio, issued a statement shortly after Bondi's directive saying, by seeking to murder Luigi Mangione, the Justice Department has moved from dysfunctional to the barbaric. Their decision to execute Luigi is political and goes against the recommendation of the local federal prosecutors, the law, and the historical precedent. In addition to the federal indictment, Mangione is being charged in Pennsylvania and New York, where he faces murder and terrorism charges. Mangione's case continues to spark national discussion about the state of the healthcare industry.